everyone, and welcome back to the channel. Imagine this scenario: you're enjoying a sunny day at the park when suddenly someone nearby collapses. Panic sets in among the crowd, but not for you. Why? Because you know exactly what to do. Today we're diving into a topic that could make you the hero of such a situation: emergency first aid. This isn't just for healthcare professionals, these are essential skills everyone should know. In this video, we're going to break down the most critical first aid techniques that can help you handle emergencies with confidence. From treating minor cuts and burns to performing CPR and managing choking incidents, we've got you covered. We'll guide you through step-by-step instructions and practical tips that are easy to remember and apply, even in high-pressure situations. But before we get started, if you find our content helpful and want to stay informed about crucial life skills, make sure to hit that subscribe button and ring the notification bell. This way, you won't miss out on any of our upcoming videos that could further enhance your preparedness and safety. So, let's get into it. By the end of this video, you'll not only feel more confident in your ability to provide first aid, but also be equipped with the knowledge that could potentially save a life. Remember, being prepared isn't just about self-protection, it's about being ready to help those around you when they need it most. Now, let's dive into these essential first aid skills everyone should know. Number 1. Check the scene for safety. Before you rush to help someone who might be injured, remember, your safety comes first. Usually when you see someone in trouble and your heart races, urging you to act fast. But wait. Take a quick breath and assess the scene. Are there hidden dangers? Think of things like fire, toxic fumes, or falling debris. These aren't just minor issues, they can be serious threats to both you and the injured person. First, scan your surroundings like a detective. Is there a live wire sparking nearby, a car accident with fuel leaking, or shattered glass everywhere? If you spot any hazards, you need to act smart. Your first mission is to ensure that you and the injured person are out of harm's way. This might mean moving to a safer spot before you start any first aid. Remember, you can't help anyone if you become a victim too. Once the area is secure, you can approach the injured person confidently. Your calm and careful assessment at the start can prevent further injuries and set the stage for effective first aid. Safety first, always. Those extra seconds you take to evaluate the situation can make a huge difference, ensuring you're not only ready to help but also staying safe yourself. So take those few crucial moments to make sure the coast is clear. It's a small step with a big impact, turning you from a bystander into a true lifesaver, all while keeping yourself out of danger. Number 2. Calling for help. Once you've determined it's safe to proceed, the next crucial step is to call for emergency help right away, especially if the situation seems serious. If someone is unconscious, there's severe bleeding, difficulty breathing, or you suspect broken bones, call for help. These are all red flags signaling you need professional assistance immediately. When you dial emergency services, it's vital to stay calm and be as clear and concise as possible. Start by stating your exact location, dropping a pin on the map. Whether you're at a specific address, a park, or an intersection, make sure the dispatcher knows exactly where to send help. Next, describe the nature of the emergency in simple terms. Is it a car accident with multiple injuries? A person who's collapsed and isn't responding? Severe bleeding from a fall? Give them a quick snapshot of what's happening. This information helps emergency responders prepare for what they'll need when they arrive. Don't forget to mention the number of people injured. This detail is crucial as it can determine how many emergency personnel or vehicles are dispatched to the scene. Whether it's one person or several, clear communication ensures that everyone gets the help they need as quickly as possible. Stay on the line and answer any questions the dispatcher asks. They might need more details to better understand the situation. Remember, they're trained to keep you calm and gather the necessary information efficiently. Your composed and precise responses can make a significant difference in how swiftly and effectively help arrives. So, to recap, once it's safe, call for help without delay, provide your exact location, describe the emergency clearly, mention the number of injured, and stay on the line. Your quick thinking and clear communication could be life-saving in these critical moments. Number 3. CPR, or cardiopulmonary resuscitation, is a life-saving technique that can literally restart a stopped heart and save someone's life. Being the person who brings someone back from the brink is powerful. But did you know that for every minute CPR isn't performed, the chance of survival drops by 7 to 10%? That's why it's crucial to act fast and efficiently. While it's highly recommended to take a practical CPR course for comprehensive training, let's go over a basic overview that can help you understand the essentials. First, check if the person is breathing. Look for any chest movement, listen for breath sounds, and feel for air on your cheek. Do this for no more than 10 seconds. Those 10 seconds are critical, they can make all the difference. If the person isn't breathing, it's time to start chest compressions immediately. Place your hands, one on top of the other, in the center of the chest. Push hard and fast, aiming for a rate of 120 compressions per minute. You have to keep the heart alive, and that's the rhythm you're aiming for. Each compression should be about 2 inches deep to ensure you're pumping the heart effectively. If you're trained in mouth-to-mouth resuscitation, deliver 2 breaths after every 30 compressions. Tilt the head back, lift the chin, pinch the nose shut, and give a full breath, watching for the chest to rise. Repeat this process twice. Continue the CPR cycles of 30 compressions followed by 2 breaths, without stopping until emergency help arrives or the person starts breathing on their own. Remember, consistency and rhythm are key here. Your continuous effort is crucial in maintaining blood flow to the brain and vital organs. Your timely assistance can save a life. Number 4. Stop the bleeding wound. Bleeding is one of those common injuries that can happen to anyone, anytime. But knowing how to handle it quickly and effectively can make all the difference. So let's dive into the essentials of managing bleeding with some practical and life-saving steps. First up, when you see someone bleeding, your immediate action should be to apply direct pressure to the wound. Grab a clean cloth, bandage, or even a piece of clothing if that's all you have on hand. Imagine you're trying to plug a leak. Press down firmly on the wound. This pressure is crucial for slowing the blood flow and helping it to clot. Keep pressing steadily and resist the urge to peak, just maintain that pressure. Next, if you can, elevate the injured area above the level of the heart. Think of it like using gravity to your advantage. If it's a cut on the arm, lift the arm up. For a leg injury, try to prop the leg up. Elevation works hand in hand with direct pressure to slow the bleeding down significantly. Now, patience is key here. Hold that pressure until the bleeding stops. This could take a few minutes, but it's important to be persistent. If you release too soon, the bleeding might start up again. Sometimes direct pressure alone isn't enough. In such cases, consider using a pressure bandage. Wrap it snugly around the wound to maintain consistent pressure. It's like giving the wound a tight hug to keep the blood from flowing out. In severe situations where nothing seems to work, a tourniquet might be necessary, but this is a tool of last resort. Using a tourniquet requires caution. Place it above the injury site, tighten it until the bleeding stops, and make a note of the time you applied it. Improper use can cause more harm than good, so only go for the tourniquet if it's absolutely essential. So, to sum it up, apply direct pressure with a clean cloth or bandage, elevate the injury above the heart, and hold the pressure until the bleeding stops. Use a pressure bandage if needed, and as a last resort, carefully apply a tourniquet. These steps can turn a chaotic situation into a manageable one and could save a life. Remember, quick action and calm thinking are your best allies when dealing with bleeding. Stay focused, stay calm, and be the hero who knows exactly what to do. Number 5. Choking. Choking is a terrifying and life-threatening emergency that demands immediate action. Did you know that choking is the 4th leading cause of unintentional injury deaths in the United States? According to the National Safety Council, in 2022 alone, an estimated 5,553 people died from choking. It's a sobering statistic that highlights how crucial it is to know what to do. Choking can happen to anyone at any age, but young children and older adults are especially at risk. It is crucial to understand the steps that you need to take to save a life. For adults, every second counts. If someone is choking, start by delivering 5 sharp back blows between their shoulder blades. Use the heel of your hand and strike firmly. Think of it as trying to jolt the obstruction loose. If that doesn't work, it's time for the Heimlich maneuver. Stand behind the person, wrap your arms around their waist, and place a fist just above their navel. Grasp your fist with your other hand and pull inward and upward with a quick, forceful motion. You should strike upwards like you're trying to lift the person off their feet with each thrust. Repeat this sequence of 5 back blows and 5 abdominal thrusts until the object is expelled or the person can breathe again. Now, for infants, the approach is gentler but just as crucial. Lay the infant face down along your forearm, supporting their head with your hand. Deliver 5 gentle but firm back blows between their shoulder blades. Be careful, but don't be afraid to use enough force to dislodge the object. If that doesn't work, flip the infant over while keeping their head supported and deliver 5 chest thrusts using 2 fingers in the center of their chest, just below the nipple line. These thrusts should be quick and precise, aiming to push air out and clear the airway. Whether you are dealing with an adult or an infant, in both scenarios, continue the cycles of back blows and thrusts until the object is expelled, the person starts breathing, or emergency help arrives. Always stay vigilant and prepared to start CPR if the person loses consciousness. Following these steps, you will always be ready to step in with the right moves to save lives if someone around you ever falls victim to choking. Quick, effective action in these critical moments can turn a potentially tragic situation into a heroic rescue. Remember, whether it's an adult or an infant, knowing how to respond to choking can make you a real-life hero. Number 6. Sprains and strains. Did you know that, according to the American Academy of Orthopedic Surgeons, over 30 million people visit doctors' offices every year for sprains and strains? That's a mind-blowing number. These injuries can happen to anyone, anytime from seasoned athletes to weekend gardeners. Understanding the difference between sprains and strains is the first step in managing them effectively. Sprains involve injuries to ligaments, those tough bands of tissue connecting bones at our joints. It can happen anytime. For example, you're leaping for a basketball, you land awkwardly, and your ankle twists. Ouch. That's a sprain. Strains, on the other hand, affect muscles or tendons, the tissues connecting muscles to bones. Imagine pulling on a rope too hard or lifting something heavy with improper form. That's your muscle or tendon when it gets strained. Both sprains and strains can cause pain, swelling, bruising, and difficulty moving the affected joint. The severity can range from a slight inconvenience to a major setback, depending on whether the injury is minor, moderate, or severe. But don't worry. Most of these injuries can heal well with the right care. Your new best friend in injury management is the RICE method. Rest and give your body a break, avoiding putting weight or strain on the injured area. Think of it as a mini vacation for your injured limb. Ice the injury by grabbing an ice pack or a bag of frozen peas in a pinch, wrapping it in a cloth, and applying it to the injured area for 15 to 20 minutes several times a day. This will help reduce inflammation and numb the pain. Plus, it gives you an excuse to chill, literally. Compress the injury with an elastic bandage to provide support and minimize swelling. But remember, not too tight, not too loose, just right. Elevate the injured limb above your heart whenever possible. This helps reduce swelling, so prop up those legs and catch up on your favorite show guilt-free. If you need a little extra help, over-the-counter pain relievers like ibuprofen or acetaminophen can be your allies in managing pain and inflammation. Sometimes you'll need to call in the pros. Seek medical attention if the pain is severe and doesn't improve with rest and pain relievers. There's visible deformity or significant bruising, you can't bear weight on the injured limb, or there's numbness or tingling in the affected area. Early medical evaluation can help rule out more serious injuries like fractures and ensure proper healing. Don't play hero when in doubt, get checked out. As we wrap up, remember that these are just some of the fundamental first aid techniques everyone should know. While they can be incredibly helpful in emergency situations, it's always best to seek professional medical attention for any significant injury or health issue. Your quick action is crucial, but professional care is often necessary to ensure the best outcome. Consider keeping a well-stocked first aid kit both at home and in your car. Having the right tools readily available can make all the difference when dealing with minor injuries. Stock it with essentials like bandages, antiseptic wipes, adhesive tape, sterile gauze pads, scissors, tweezers, and pain relievers. Regularly check and restock your kit to ensure everything is up to date and ready for use. Most importantly, don't be afraid to act in an emergency. Often, people hesitate because they fear making things worse, but inaction can be far more harmful. By knowing these basic skills, you empower yourself to step in and make a real difference. Imagine the peace of mind that comes from being prepared, knowing you can provide immediate assistance until professional help arrives. If you found this information helpful, please give this video a thumbs up. Your support helps us continue to create valuable content. And don't forget to subscribe to our channel. By subscribing, you'll stay informed about essential health tips, safety techniques, and other life-saving information. Click the notification bell so you never miss an update. The knowledge you gain today could save a life tomorrow. Emergencies don't come with a warning, but with the right preparation and mindset, you can face them confidently. Remember, every second counts, and your quick response can turn a potentially tragic situation into a story of survival and hope. We appreciate you taking the time to watch this video. Share it with your friends and family so they too can be equipped with these crucial skills. Together, we can create a community that's ready to help and protect each other in times of need. Thank you for watching. We'll see you in the next video. Until then, stay safe, stay proactive, and take care.